Although there may be people out there who don't want to admit it, in the field of physical therapy and strength and conditioning, there tends to be a divide between the two fields. And it's unfortunate because there's actually a lot of similarities between the two, which is the purpose of this video. There are a lot of strength and conditioning coaches who think that physical therapists are too conservative. But on the other side of the coin, there are a lot of physical therapists who think that we strength and conditioning coaches are too aggressive and that we're part of the reason why athletes and clients get injured and end up getting sent to physical therapy for rehab. So what I'm going to do in this video is explain how in proper program design, it'd actually be really beneficial if strength and conditioning coaches understood therapeutic guidelines and implemented them as part of their overall program design, especially in the early stages and especially with consideration for prehab to avoid joint injury or pain, and then also to understand the appropriate philosophy and approaches and concepts to apply when an individual does have joint pain. And then it would also be beneficial if more physical therapists understood and implemented, whenever possible, strength and conditioning concepts and progressed patients in a periodized fashion across a spectrum of repetition ranges and progress their strength and conditioning as much as possible before preferably handing them off to a qualified exercise specialist. So I'll go ahead and explain how the fields of strength and conditioning and physical therapy or musculoskeletal rehab aren't divided, but they actually merge. Although there will be plenty of similarities and crossover with general and special populations, I just want to be clear that I'm setting athletes and return to sport to the side, and I'm just referring to physical therapy or musculoskeletal rehabilitation for the general and special populations. And I also want to make sure that it's clear that I'm just using this video to get some concepts across so that I can relate musculoskeletal rehabilitation with how a proper overall exercise program should be set up. So generally speaking, there are 4 stages or phases in musculoskeletal rehab. You don't necessarily have to leave one before you can enter another. They definitely overlap. But typically the first stage is because pain and or swelling exist. And so that's the first thing the therapist needs to tackle. And because of the pain and swelling, the joint or joints have completely or mostly shut down. And that's where therapists are going to use modalities such as icing, electric stimulation, ultrasound, and manual therapy as ways to reduce or negate the swelling and inflammation so that they can shift their emphasis to stage 2, which is where you want to restore the range of motion that's been lost to preferably at, or at the very least, as close to normal range of motion as possible. And then when the pain and swelling has reduced enough that load bearing can occur, the therapist can start to introduce stage 3, which is where you want to restore or improve motor control, which really just means establishing proper movement patterns or proper form. And this commonly includes light loads with single joint exercises where the emphasis is on the lowering or eccentric part of the movement. And when applicable, it's also going to include isometric holds as one of the ways to improve local joint stability. Many times in physical therapy, because of limitations with insurance and how insurance will dictate that there are only X amount of sessions that the patient is able to complete, there are many times that the therapist can't spend adequate time in stage 4, and sometimes they can't even move to stage 4, which is where you not only continue to restore or improve motor control involving more of the kinetic chain, which just means multiple joints now, such as with the lower body, loaded squats and deadlifts and multi-directional lunges, and with the upper body, less emphasis on single joint exercises and more emphasis on pulls and presses. But stage 4 should also include force absorption exercises in a perfect world, such as step downs as a more basic form of a force absorption exercise for the lower body, or for more advanced individuals, things like hops, bounds, and jumps. And also in a perfect world, stage 4 should include an increase in variety, more set volume, so you should be performing more sets per muscle group within the scope of a session and within the scope of a week, a wider spectrum of repetition ranges, so it's not always 2 or 3 sets of 10. And stage 4 should also include progressions in load so that you're getting stronger within each repetition range. And something that therapists don't have the ability to do because of limitations from insurance is that stage 4 in a perfect world should include total body strengthening and not just strengthening for the part that's injured. But one of the main points is that setting swelling or inflammation to the side and just focusing on stage 2, 3, and 4, the common themes that apply to rehabilitation and should also apply to strengthening programs for general and special populations is that you want to restore mobility or flexibility in areas where there are restrictions. You want to teach and ensure proper movement patterns or proper form with every exercise. You want to start with conservative loads, progress in small tolerable increments, and design a program that creates strength balance around each major joint, which means that the program design should include bilateral and unilateral exercises, multi-joint and single joint exercises, and strengthening in each plane of motion. And one of the things I've learned from working in sports medicine and rehab atmospheres for the past 15 years is that no matter what the musculoskeletal condition is, and no matter where it is, where they're tight, you want to get them mobile because the body seeks balance, and that's how you balance flexibility and mobility. Where they're weak or hypermobile, you want to get them strong because that's how you create strength balance around each major joint. And to improve and instill motor or neuromuscular control, you want to make sure that you're doing everything with proper form. And then it's just a matter of knowing and selecting joint-friendly exercises for the affected joints. Because it really doesn't matter what the diagnosis or condition is. There are joint-friendly exercises for each major joint in the body, which by their very nature reduce the stress on the joint. And because of that, allow you to continually progress in loads as long as you're doing it in small tolerable increments. And that's the reason why, with appropriate initial start points, appropriate rates of progression, staying within the person's pain-free available range of motion, and choosing joint-friendly exercises for the areas where they have joint pain, allows resistance training to be a safe mode of exercise for pretty much everyone on this planet, no matter what their condition is. And honestly, since everyone can safely go through physical therapy, then it means that everyone can perform muscle strengthening exercises, which means that everyone can be placed on a safe, progressive, total body strength and conditioning program. Where they're tight, get them mobile. Where they're weak or hypermobile, get them strong. Ensure proper form. Make sure you progress and create total body balance. This is really the recipe for prehab, rehab, post-rehab, and general fitness. So that's all for this one. Make sure you watch my videos on how to merge the fields of strength and conditioning and sports medicine as they relate to each repetition range so that you can build a strong and healthy body over the course of time. So thanks a lot for watching, and I'll see you in the next one.